If you are over 60, I want you to picture something with me for a second. A bottle of pain relievers in the kitchen drawer, a heartburn pill on the bathroom shelf, blood pressure medicine beside the bed. Nothing about that looks dangerous. And yet some of the most common medicines older adults use every week can quietly strain the kidneys long before there is pain, long before there is swelling, and long before most people realize anything is wrong. Kidney disease is often silent, and it becomes more common with age. What worries me most is that one of these four medicine groups catches good, careful people completely off guard. And if clear, senior-friendly health guidance like this helps you protect yourself and your family. Subscribe, like, and share this with someone you care about. I have seen this happen in very ordinary situations. Someone has a sore back and takes a few extra pain pills for a week. Someone else keeps taking their usual blood pressure medicine while they have vomiting, diarrhea, or the flu. Another person stays on a heartburn drug for months because it seemed harmless and no one ever circled back to review it. Then one routine lab test shows the kidneys are not filtering the way they used to. That is the part that unsettles people. They say, "But doctor, I was only taking what I thought was normal." And here is what most people get completely wrong. Kidney trouble from medicine does not always begin with a dramatic warning sign. It can build slowly, quietly, and in seniors, it can happen faster because aging kidneys often have less reserve to begin with. The risk climbs even more if you already have diabetes, high blood pressure, heart disease, dehydration, or unrecognized chronic kidney disease. Most people do not realize this, but many adults with chronic kidney disease do not know they have it. That means a medicine that looks routine on the outside may be landing on kidneys that are already vulnerable. And when that happens, the problem is not always the medicine by itself. Sometimes it is the medicine plus dehydration. Sometimes it is the medicine plus another prescription. Sometimes it is the medicine plus age-related changes in kidney function. That is why I want to slow this down and make it simple, because fear does not help anyone, but clear information does. I'm Dr. Charles Oliver, and in my years working with senior patients, I have seen the same pattern again and again. Good people trying to take care of themselves, but no one ever fully explained how easily the kidneys can get caught in the crossfire. Research and guidance from respected organizations like the CDC, NIDDK, and the National Kidney Foundation all point to the same message. Protect the kidneys by reviewing medicines carefully, especially in older adults, and especially during illness, dehydration, or long-term medication use. So let me walk you through the four groups I watch most closely in everyday practice. Before we get into the first one, I want to give you one simple framework. Your kidneys are filters. They clear waste, balance fluid, and help keep your body stable. When a medicine reduces blood flow to the kidneys, irritates kidney tissue, or builds up because the kidneys cannot clear it well, the damage may show up first on lab work, not in the mirror. That is why two of the most useful tests are a blood test called eGFR and a urine test that looks for albumin. Those two markers help doctors spot trouble early, sometimes before you feel anything at all. The first medication group is the one sitting in millions of homes right now, NSAID pain relievers. I'm talking about medicines like ibuprofen, naproxen, and higher dose aspirin. Now here is the thing. People often think, it's over the counter, so it must be gentle. But over the counter does not mean over the kidneys. These drugs can reduce blood flow to the kidneys, and that risk goes up if you use them often, use them for a long time, already have kidney disease, or take them when you are dehydrated, or your blood pressure is running low. That is not a fringe concern. It is standard kidney safety advice from major medical organizations. I had a patient once, a retired school bus driver, who kept a bottle of ibuprofen in his coat pocket because his knees bothered him every afternoon. He was not abusing it. He was not doing anything reckless. He just wanted to keep moving. But he also had high blood pressure, and on top of that, he had a stomach bug one week and barely drank enough fluids. By the time his labs were checked, his kidney numbers had slipped. The real problem was not just the pain reliever. It was the pain reliever plus dehydration, plus the fact that his kidneys were already working with less reserve than they had 20 years earlier. And I want you to really pay attention to this part. NSAIDs often hide in cold medicines too. So someone may say, I only took something for my sinus pressure. not realizing they doubled up on kidney stress without meaning to. Practical tip. If you are over 60, do not assume every over-the-counter pain or cold medicine is harmless for your kidneys. Read the label, look for NSAIDs, and ask your doctor or pharmacist whether it is safe for you personally, especially if you have high blood pressure, diabetes, swelling, heart disease, or any history of kidney trouble. And never use these medicines casually for days on end without checking in. Always consult your doctor before making any health changes. But that is only the first surprise. The second medication group is proton pump inhibitors, often called PPIs. These are medicines such as omeprazole, esomeprazole, lansoprazole, and pantoprazole. They are commonly used for heartburn, reflux, and ulcer prevention. And to be fair, they can be very helpful. I prescribe them when they are needed. But the trouble starts when a short-term medicine quietly turns into a forever medicine. The National Kidney Foundation notes that short-term use is not expected to cause kidney-related side effects in most people, but with longer-term use over months or years, the risk of problems like acute kidney injury goes up. Most people do not realize this, but one of the kidney problems linked with PPIs is a type of inflammation in the kidneys called interstitial nephritis. You are not expected to remember that name. What matters is the idea. A medicine taken for the stomach can, in some people, trigger trouble in the kidneys. And older adults are especially vulnerable to medicines that stay on the list month after month, simply because no one revisited whether they were still necessary. I remember seeing this pattern again and again. A patient starts a heartburn medicine after a hospitalization or a course of steroids. Months later, they are still taking it. Then years pass. Nobody asked, "Do you still need this?" One woman told me, "Doctor, I thought it was just part of my vitamins." That stayed with me, because that is how quiet medication creep can be. Something helpful at the start becomes automatic later. So here is the practical move you can use today. Look at your medication list and circle any heartburn medicine you take regularly. Not to stop it on your own, not to throw it away. Just circle it and ask at your next appointment, "Do I still need this? If yes, what is the lowest effective plan, and do my kidneys need monitoring?" That one question can change the whole conversation. And if you have been taking a PPI for a long time, it is worth making sure your doctor knows about it, especially if your kidney numbers have changed or you have had repeated dehydration, infections, or hospital visits. Always consult your doctor before making any health changes. Now here is where many people get blindsided. The third group is certain antibiotics, and I need to say this carefully because antibiotics can be absolutely necessary and sometimes life-saving. The goal is not to fear them. The goal is to use them wisely. The kidneys clear many antibiotics from the body. If kidney function is reduced, some of these medicines can build up, and when levels get too high, the risk of side effects rises. Some antibiotics can also directly injure the kidneys in certain situations. The National Kidney Foundation specifically notes that many medicines used to treat infections leave the body through the kidneys, may need lower doses or less frequent dosing when eGFR is lower, and in some cases can damage the kidneys if too much builds up in the blood. This becomes especially important in older adults who get dehydrated quickly, who already have reduced kidney function, or who are taking several other prescriptions at the same time. I have had patients come in after a urinary tract infection or pneumonia, and the infection itself was only part of the story. They were also drinking less, eating less, and taking medicines their kidneys could not clear as easily as before. That combination can be hard on the body, and this is the part families often miss. A perfectly appropriate antibiotic can still need extra care if the kidneys are not filtering well. That is why kidney-safe prescribing is not just about choosing a drug. It is about choosing the right dose, the right schedule, and sometimes repeating blood work if the illness is serious. In hospital settings, doctors watch this especially closely with higher-risk antibiotics, particularly when patients are older, frail, or already medically complex. A practical tip here is very simple. Whenever a new antibiotic is prescribed, ask one calm question. Do my kidneys affect the dose of this medicine? That question is gold. It tells the clinician you understand that kidney function matters. And if you or your loved one is feeling weak, confused, very sleepy, swollen, or suddenly not urinating normally while on a medication for an infection, do not ignore it. Call the doctor promptly, not because every antibiotic causes kidney injury, but because older adults deserve early attention, not late regret. And please remember, never skip or stop an antibiotic without medical guidance, because untreated infection can be far more dangerous. Always consult your doctor before making any health changes. But wait, point number 4 is the one that surprises most people. The fourth group is not one pill sitting alone. It is a trap created by common prescriptions during the wrong moment. Blood pressure medicines such as ACE inhibitors or ARBs and diuretics, also known as water pills, when you become dehydrated from vomiting, diarrhea, fever, or poor fluid intake. And let me be very clear here, because this is where people get confused. These medicines are not bad medicines. In fact, ACE inhibitors and ARBs can help protect the kidneys over time in the right patient. Diuretics can be very important for blood pressure and heart failure. The problem is not the medicine in normal circumstances. The problem is the medicine during dehydration or low blood pressure. The NIDK explains this beautifully. When you are sick, losing fluids, or unable to drink enough, blood pressure can fall and blood flow to the kidneys can drop. Healthy kidneys can often protect themselves, but if you keep taking certain blood pressure medicines while badly dehydrated, the pressure inside the kidneys may fall so low that they stop filtering normally. Add an NSAID on top of that, and the risk can rise even more. That is one of the classic ways a senior can slide into acute kidney injury without ever intending to do anything wrong. I had a patient in his 70s with the flu, poor appetite, and 2 days of diarrhea. He kept taking everything on his usual schedule because he was trying to be disciplined. That included his blood pressure medicine and his water pill. He also took an NSAID for body aches. By the time he came in, he was weak, lightheaded, and his kidney numbers had taken a real hit. What struck him most was this. He thought being good with his medication meant never missing anything. No one had ever taught him that illness changes the equation. So here's the actionable tip I want you to remember. If you are over 60 and you take blood pressure medicine, an ACE inhibitor, an ARB, a water pill, or regular NSAIDs, ask your doctor or pharmacist for a sick day plan. Ask, if I get vomiting, diarrhea, fever, or cannot keep fluids down, are there any medicines I should temporarily pause until I recover? Do not create that plan on your own in the middle of an illness. Make it ahead of time, when you are thinking clearly. That single conversation can prevent a hospital visit. And again, never decide by yourself to stop long-term blood pressure medicine permanently. Always consult your doctor before making any health changes. Now let me bring this all together in the simplest way I can. The 4 medicine groups I want you to remember are these: common NSAID pain relievers, long-term heartburn medicines called PPIs, certain antibiotics that need kidney-aware dosing and monitoring, and blood pressure medicines or water pills used during dehydration without a clear sick day plan. None of this means every person should fear these medicines. It means older adults need a medication plan that fits the reality of aging kidneys. If you take anything away from our time together, let it be this. Do not wait for kidney damage to feel obvious. Ask to know your eGFR. Ask whether you have protein or albumin in the urine. Ask whether any over-the-counter medicine in your home could stress your kidneys. Ask whether any prescription should be reviewed, reduced, or monitored more closely. These are not dramatic questions. They are wise questions. And wise questions protect health. I do not want you leaving this conversation scared. I want you leaving informed. Your kidneys do a quiet job every minute of every day, and they deserve that same quiet protection from you and your medical team. If you are a senior living with diabetes, high blood pressure, swelling, or a long list of medications, this is not a reason to panic. It is a reason to get organized. Put all your medicines in one place. Bring the list to your appointments. Review over-the-counter products too, not just prescriptions. And please, always consult your doctor before making any health changes. If this helped you, share it with a spouse, a sibling, a neighbor, or anyone who keeps a few familiar pills around the house and assumes familiar means harmless. And next, I want to talk with you about the early warning signs Your kidneys may be struggling before a crisis happens, because sometimes the body whispers long before it ever starts to shout.